Hi, I'm Dr. Donna Gourlay. Welcome to Public Health Workforce. In this video, I'll discuss the workforce within the field of public health. You will learn about the strengths, challenges, and opportunities within this field, and hopefully start to envision where you will fit in when you graduate and become a public health professional. I've been a public health professional since 1986. I've worked in the fields of health policy, environmental health, healthcare, and academia, and I've never had a day where I thought, I really don't want to go to work today. That's because public health is a dynamic field where no day is the same. And that's because people aren't the same, the environment isn't the same, and circumstances aren't the same. Up until the mid-20th century, public health issues in the U.S. revolved around infectious diseases, primarily due to unsanitary conditions within the environment. However, as sanitary sewers, drinking water distribution, pasteurization, refrigeration, and vaccinations were implemented, infectious diseases rapidly declined and the population's longevity significantly increased. In the second half of the century, public health issues evolved into lifestyle-related diseases like heart disease, cancer, and diabetes. And during this time, policy changed that no longer required assessing and reporting to identify public health workforce trends. Public health has a symbiotic relationship with healthcare. They depend on each other to keep the public healthy. While public health focuses on prevention, healthcare focuses on diagnosis and treatment, and both are needed for population health. As we previously studied, policy can be enacted at multiple levels. However, state agencies take on the role of oversight for the local agencies. This means that local public health employees do the field work, and state employees are typically in administrative roles. When people ask me what I do and I say, I work in public health, most of them have a strange look on their faces because they aren't sure what that means. This is due to an identity crisis created by the following issues. In public health, there are many standard occupational classification system job titles. That's a lot. It's a lot of words. Many are based on outdated civil service job titles and job descriptions. Public health includes a wide variety of jobs and different settings, and it includes a lot of different people who deliver these services. In 2011, the CDC, HRSA, and the Public Health Foundation commissioned a study on the public health workforce. They discovered the following issues. Many uncoordinated studies were conducted using a variety of data collection methods. A lack of professional classification schemes and categories for public health jobs. The absence of professional credentialing requirements. And a workforce that was discipline-specific, such as medicine, nursing, behavioral health, but uneducated in the field of public health. This study and others found that there are unique strengths to the current public health workforce. It is a diverse group of people, representing different age groups, ethnicities, religions, and there are a large number of career fields represented, such as nursing, dentistry, medicine, veterinary science, psychology, and others. Also, people in the field of public health tended to be service-oriented, meaning that they're interested in serving the public to improve the health of the population. I can't think of any other field that can say this, even healthcare, particularly since public health incorporates a variety of other disciplines into it. This is a collage of the victims from the massacre that occurred on December 2nd, 2015 in San Bernardino, California. As you can see, this group has a wide range in age, gender, and ethnicity, and represents the diversity within public health. Most of these people were environmental health professionals, which is a discipline within public health. As an environmental health professional, I personally knew several of these people who died, in addition to the traumatized survivors. Public health is changing, and a few of these trends include downsizing of state agencies, an aging workforce that is gearing up for retirement. States and federal government are shifting from providing clinical care to transferring that responsibility to larger healthcare organizations. Funding is disappearing from public health preparedness activities. And leadership positions have a notoriously high rate of turnover. Most public health agency leaders stay for an average of less than 3 years. As things change within the public health workforce, other areas that are growing include informatics, such as GIS, genomics, communication, cultural competence, community-based participatory research, global health, public health policy, law, and ethics. So with an MPH degree and the training you receive, this can make you more marketable in terms of career potential. So how do we grow the public health workforce? Some suggestions include the following. Credentialing the workforce. Remember how we've talked about the CPH exam? That is the first step. Increasing education requirements, such as bachelor's, master's, and doctoral public health degreed professionals. Providing public health training and continuing education so that the workforce stays current in the field. And helping the current workforce to develop into good leaders, or succession planning, not just good technical professionals. So, where will you fit in the future of public health? Getting your CPH credential after PCOR is a good place to start. Then targeting an area of future growth and obtaining skills in that area. These things, along with a good attitude and hard work, will make you very marketable when you graduate and begin your career in public health.